Are you exhausted from watching your child struggle with ADHD signs despite trying every traditional approach? Maybe you sat through countless appointments. Doctors that quickly handed out a diagnosis, then prescribed a medication, then increased that dosage or switched brands when it didn't work. Sound familiar, mom and dad? If you're like so many parents that we've met, you've probably walked away wondering, is there something more that I could be doing? Or is there anyone else who's actually asking why this is happening in the first place? At our office, we see this all the time. Here's the reality. Over 7 million children in the US have been diagnosed with ADHD. And those numbers keep rising. But traditional testing methods, they focus entirely on labeling and categorizing signs, not actually identifying what's causing them. And without getting to the root cause, we're left chasing symptoms and short-term solutions. This video is for parents who are tired of Band-Aids, who've tried the meds, who've followed the routines, and yet you're still wondering what is really going on with my child. If you're seeking real answers and want to explore natural, drug-free options that actually address the root cause of ADHD, this could change everything. We're going to dive into why traditional ADHD testing often falls short, what two main types of ADHD look like in real life, how we use insight scans to uncover the real root cause, and how this neurologically focused chiropractic approach can help transform ADHD daily struggle into a manageable strength. So let's jump in. Let's start by identifying the patterns we see most in practice. Those two main types of ADHD that we see is the first type is raging bull. This is the most common in children under 5. These kiddos charge through their life 100 miles an hour. They're on the go. Their minds are busy. They struggle to slow down and stop and sit still. The second is drunken bull. These children may not appear hyperactive, but they're easily distracted, forgetful, and have a hard time staying on track. This often gets missed and mislabeled as laziness, lack of motivation, especially in older children. In most kids, they're a combination of both, hyperactive and inattentive, impulsive and disorganized, which means their care plans need to address both sides. Now, I want to move on to a traditional approach of ADHD testing and the critical problem that comes with it. Traditional testing relies heavily on checklist surveys and surface level behavior assessments. They help doctors categorize children, but they don't reveal why behavior is happening in the first place. There's no assessment of brain function, no deep dive into the nervous system, no look at the actual stress and disorganization driving these signs we see. That's why so many care plans fail. Because if your testing doesn't measure the root, you're only solving a fraction of the problem. And sometimes you're not solving it at all. This is where things get exciting though. At our office, we use a powerful tool called the Insight Scan. It's non-invasive, it's quick, and incredibly informative. These scans measure the exact levels of stress, tension, and dysfunction in your child's central and autonomic nervous system, which is the control center for behavior, focus, mood, and so much more. And here's how it works. For raging bull kids, we look at the total energy index. A healthy score is 150 or below. Many hyperactive children we see are well above that, showing massive nervous system stress. For drunken bull kids, we focus on pattern scores. 100 means ideal neurological organization, but children with focus and attention challenges often score as low as 40 to 50. This isn't just a label. These scans show us where the stress is and how much stress there is and how we can help correct it. So what's driving all of this? It comes down to a subluxation. Areas of dysfunction and disorganization within the autonomic nervous system that disrupt how the brain and body communicate. And believe it or not, this dysfunction rarely starts in elementary school. It usually begins much early in what we call the perfect storm. Chronic stress during pregnancy, birth interventions, early life stressors like colic, reflux, and poor sleep. These events prime the nervous system to be stuck in fight or flight, causing various signs associated with ADHD, hyperactivity, inattention, emotional outbursts, sleep struggles, and sensory overwhelm. But when we can identify the pattern of dysfunction and support the nervous system from the inside out, we see incredible shifts. Now, for the most important part, what can we do about it? With neurologically focused chiropractic care, we're not just adjusting the spine, we're actually restoring communication between the brain and the body. Through gentle, specific adjustments, we release the stress in overactive systems, helping activate the calm side of their nervous system. We also stimulate the vagus nerve, which is crucial in digestion and focus and attention. By using the Insight scans, we can track the progress over time and seeing how their nervous system is doing. And here's the truth, ADHD is not a life sentence. Your child isn't broken. They don't need to be fixed. They just need to be understood. When we stop focusing on surface level labels and start asking what's really going on underneath, we then find answers. Better yet, we find hope. Click the link in our bio to learn more about Insight scans and how we can help your child thrive from the inside out. Your family deserves care that looks deeper, so let's get started together.